I'm Heather Duncan. I practice advanced dentistry here at Upstate. The difference between your family veterinarian and what Upstate's dentistry department can offer is if you will think of your family veterinarian as your general dentist that we go to. They can do a lot, and if they have anything more advanced, like a fractured tooth that they want to do root canal therapy, or an oral mass or any type of advanced oral surgery, that's what we're here for. A lot of pet owners will come see me when they've been referred by their primary veterinarian. And a lot of animals, 85% of animals that are 3 years of age or older have periodontal disease, so that's a huge one that we see. Also fractured teeth. As we know, a lot of dogs like to do crazy things with their mouth. Those are their fillers. So they'll put objects in their mouth, fracture their teeth. Also animals that have been hit by a car or suffer from anxiety and have tried to chew, their way through a fence or a door. A lot of the main teeth that are used for chewing, for playing, we like to try to save those with root canal therapy or vital pulp therapy, depending on the timing of the fracture. So there are a lot more advanced things we can do now instead of just extracting a tooth so that a tooth can remain in the mouth and be functional. So when I first met Sachi, she was about 5 months of age. Mrs. Ulmer had noticed that she was having some bad breath and just kind of more lethargic or laying around more than normal. Some of the signs that you can look for at home: if you smell an odor to your pet's breath, there should not really be an odor. Cats, a big one would be if they're chewing on one side of their mouth versus the other. So they're tilting their head to chew because maybe one side of their mouth there may be teeth that are damaged or that are painful, so they're trying not to use those. Dropping food out of their mouth as they're eating. So sometimes if they bite down on a kibble, realize, oh, that hurts, and then they drop it, you might feel that your pet's become more of a messy eater than they used to be.
I told Dr. Duncan about her lethargy and the bad smell that I smelled, and when she put her under to take the x-rays and look at her teeth, she found that there was just a tiniest little sliver of the root of one of those baby canines, and that was what was causing the problem.
So we were able to do surgery to remove that root, which was infected.
She gave us some medications to keep her temperature down and some antibiotics to give her as well, and she also told us not to use like hard kibbles. We used soft food, which of course Sachi really hated. But so her recovery went quite well. The worst part of it was she was spoiled. She loves soft food now. Sachi doesn't let just anyone hold her, and you can see that she feels quite at home with Dr. Duncan here.
Makes me feel special.